Have you been in a motor vehicle accident lately, or maybe had a big collision in a sporting event, and now that neck pain is becoming more and more bothersome every single day? You may be experiencing a condition called cervical whiplash, and this affects more than 85% of those in high collision activities such as a motor vehicle accident or a high collision in a sporting event. Cervical whiplash involves typically hyperflexion or extension of the cervical spine or the neck, and this can cause damage to not only the muscles but also the ligaments and other structures in the area. Here at Health-Fit Chiropractic and Sports Recovery, we work to help alleviate cervical whiplash as fast as possible to get you back to your sporting event or normal activities of daily living pain-free. In the office here, we do this by starting with a thorough examination. Here we're going to talk about past medical history, present medical history, any relevant information that will help guide our treatment going forward to getting you back to pain-free. We'll then begin our hands-on portion of the exam, where we'll go through things such as ranges of motion of the cervical spine, which can involve flexion, extension, lateral flexion, or even rotation. And then we'll perform orthopedic testing. Orthopedic testing will help us rule in or out specific diagnoses that can help us once again tailor that treatment plan to your specific needs to get you back out onto the field or back to normal living as fast as possible. Once we've conducted our orthopedic testing, we'll begin treatment here on that very first visit. Treatment here at HealthFit has a variety of different approaches, and we like to use evidence-backed treatment. What that means is we look at what research shows for conditions like cervical whiplash, and we implement those treatment strategies to help you get back out onto the field. We'll often incorporate things such as soft tissue manipulation, and here in the office, that's going to be active release technique, or sometimes called ART. This is the gold standard for soft tissue manipulation, and it'll work to help alleviate any of the tension or trigger points, some of those muscle knots you may be feeling in the neck while you're dealing with cervical whiplash. We'll also talk about if and when spinal manipulation is beneficial to you. With that, we're looking at the joints and joint complexes that may have restricted ranges of motion, and we want to use the adjustment or joint manipulation to restore that proper range of motion to the area. Once we've cleared soft tissue restrictions as well as joint restrictions in the area, we're then going to incorporate a home exercise plan. This exercise plan is going to be tailored to you, and it's going to include exercises you'll do in the office here with either one of us clinicians or one of our rehab specialists in the office, as well as exercises you're going to do at home to make sure that we're getting better as fast as possible. With that, you'll also carry these exercises into the future with you, so if you were ever to sustain an injury similar to this into the future, you have some tools at your disposal to help you start treating that condition on your own before presenting back to our office. If you have questions about how a chiropractor can help you deal with cervical whiplash, stay tuned for more videos in the future and give us a call today. We'd be happy to help. Take care.